Got it. Shock collars, actually.
Nice.
We hand those out.
Isn't that good?
All right, so we're good to go. Sure. Battery sometimes did this. Let's see. No, that's working. So you can use this if you'd like, or you can just do it on that. So
okay, so
it's just forward and back.
Yep, perfect. Yep, good. We have one at Southern that is forward and backward actually reversed. So if you hit backward, you go forward and forward. I don't know how that happened. It's kind of, you normally pay extra for it, like a gag gift on holidays.
Right. All right, you're good to go.
Thank you much.
All right. Get your pizza time.
Pizza time.
All right, shoe thing. This is Mark Rivera, shoe thing. He had an ADDA project years ago.
Years ago.
About rank and rank ligand.
I've heard the term. I'm not familiar with the science. I apologize.
So,
Bone metastasis.
bone metastasis, osteoporosis, cancer bone metastasis.
But when we did the screen, the hits that came out of it, either the cameras didn't like the structure or they were not very potent, so it's kind of one of those, like Mother Nature.
It happens, yeah.
So she's still doing some follow-up studies. So, see if you can get some funding.
Yeah, I'm really interested in your lecture today. So actually, I submit, this Bayer.
Yeah.
So
Okay. Yeah.
They have called grants for targets.
Yes.
I survived information I submitted.
Okay. Good.
So I kind of trying to try different things. Like one collaborate with drug company, or I don't know. Well, maybe find a little company. Because she's behind the startup business.
Exactly.
So I guess this is your specialty, right? You start business.
I hope so. Not so much starting businesses, but licensing. So most of what we're doing through ADDA is one of the points I want to make is that we, in the drug development cycle, we are very early. So sometimes very, very early.
Yeah.
So you with Southern Research?
I'm with Southern Research.
So how long have you?
2 years.
So what were you?
Before then, I was with doing business development for a division of Dr. Reddy's Labs, Indian-based pharma company. And before that, for 4 or 5 years, I was doing business development for another Indian company called Glenmark Pharmaceuticals.
Okay. So you have a lot of experience, like starting a new drug company, right? Small.
Not so much starting the company, but
how to operate.
But how to try and find a partner for what you have in-house, and that's really.
It's like matchmaking.
Yeah, more so. I mean, the possibility of starting a company is always there, and that would be nice, but it's a little complicated. I've spoken to some investors about theoretically, and what they've come back with, broadly speaking, is permitting is very difficult.
So you
to start with that, and then the type of assets.
So you from companies' point of view, or from like a researcher's point of view, like you both trying to help companies, right, identify.
It's doing I'm
trying to make the bridge between the researchers over here and the company over there. I'm trying to matchmake, basically.
Yeah.
So.
So let's get some pizza real quick.
Hey, Mark.
I'm
Lena.
I think we met for like 12 seconds at a Christmas party once.
Oh, good.
Something I never thought I'd be saying at this point in life, but but yes.
Okay.
And Brian.
Of course.
Good to see you.
Good to see you, right?
Yeah.
Glad you guys are here.
Yeah.
Hey
Hey there, I'm Brian McGeehan with Southern Research.
Oh, Xufeng.
Okay.
Yeah.
Are you with UAD?
UAD.
Okay.
We just talked about it. I actually had a project.
Okay.
So you guys did a high throughput screening for me.
Cool.
I have some cover now. I'm trying to move my cover forward.
Yeah. Okay. Great. Well, it's nice to meet you.
Okay, nice to meet you too.
I'm Nina.
You also with
Hi.
Hi. He's in the back. I'm good.
Well, definitely awesome.
Yeah. Trying to eat healthier. I don't think this qualifies.
Yeah, right.
Yeah.
It's here.
And it's sort of veg.
That's what I went for.
Are you going to buy that trip?
Yeah.
Good.
Yeah.
Good.
So I booked my hotel, but I don't think I've registered yet. So
I haven't either.
Yeah, I started
Partners
ordering open. Yeah. But I figured you would handle all that.
Yeah, I'll handle that. That's fine. I have no problem. No, I'm reading the rolling out. I got back from Europe.
Yeah.
And then first day back, email. partnering for bio starts.
Yeah. Yep. Yeah, because I booked my hotel actually alerted me that Mark snatched the last room in like the Marriott.
In one hotel.
Yeah. So I think less than a mile away.
That's not bad.
Yeah, that's not bad. Yeah, I don't think I registered yet because I would have remembered paying the outrageous fee. Of several $1,000s.
Really. With partnering, so the registration and then partnering on top of that.
Exactly.
Because they can't.
Yes. Is Bar Europe as expensive?
It's all one fee.
Okay.
So it's like $2,500,
Yeah.
something like that. But it's all, and it's much more. It's about 2,500 people. It's not. So it's about, not a tenth, but maybe a little bit less. And it's all kind of one big area.
So which department are you in?
And the booth, and then around the outside part of the area.
Yeah, so we are each in the external years department, so I do the fundraising at the
So
and
that's what as soon as I saw the
supports
poster
the
book
entire
next
team
spring,
and external.
I gotta click,
Nice to
send.
be, like, to come and listen and get a better understanding.
I think I may need to go.
This is not what
I
we
think
do
it would
every
be
day.
So you fundraise and find to get
And the springs are always
It's
not
not
around,
bad.
like
Yeah.
last year, Portland, last year was not.
Yeah, it would be interesting to adventure
So the
philanthropy,
fall ones
but,
in November are always in Germany.
but I'm
Okay.
doing, straight up nonprofit
Yeah.
fundraising.
So this year,
Yeah.
Berlin last year was
So
Cologne.
what, tell me about
But
the
I think the
hometown,
company
what's
itself
your,
does these, Europe, the German company.
Yeah, I'm working
I've
on molecular
Sort of an obligation, some to
Right.
have,
okay?
but I wish they moved it around.
Right market, right, what the system. Right market is Saticon, right is
I think I may need to
it's a receptor and cell surface. So this system
It's
is
a little bit
very
transparent if I can tell it myself.
No, that you need to go to.
Based on the cost.
Exactly, yeah.
Have you ever
Oh, where is it? It's somewhere in Europe. Well,
all resolving cells?
Yeah.
well, let me look it up and find it.
This is the cell which
Oh, right. How do you know?
development.
I think Cologne's not that far either.
By sheer coincidence.
And
So this year's in
also
Berlin.
these cell, all resolving cells is involved in like cancer or metastasis, breast
San Diego
cancer,
will be
prostate
interesting.
cancer, lung cancer has a high
Dr. Martin said the aircraft looks pretty reasonable.
metastasis.
Oh,
Also metastasis get
Pretty sure I have,
metastasis in the cells. I think they can be very bad. I think,
it's just a registration.
Yeah, I'll do that when I get there.
So,
Mhm.
so since these
For
cells
overall
are
profiles.
involved in breast cancer, we'll try to do
Some reason.
a lot of cancer several companies working on
Oh,
develop,
sure.
one company called ADDA developed
Really? Yeah.
Yeah, if we can confirm
gas these
that the hits
molecules.
are working. And
Mhm.
Antibody has been approved for treatment
Yeah, I know
of
what
disease
TBI.
as well as
yes,
Yeah,
breast cancer
little
or metastasis.
great.
So what I'm
so that
trying
was,
to do
people
is
getting, they kind of
find
like
beta
Mhm.
drugs. Still targeting the system, beta.
Did you hear about the new projects that got picked?
I think the drug target
Lung influenza.
we identify
It's a little bit more advanced screen that's already been done. And working and
We're gonna have
yeah, I can do NMR to kind of run it.
so we have a few
See
side
that you might
effects
start it.
Okay,
and
And then the other one,
okay.
so that's that's hopefully I think my project
between
was
pre-proposal and post-proposal, we had a meeting to kind of
my
help people,
project
like,
started
giving feedback, like, things like this.
2011.
I mean, it's a
I
Huntington's
think that
disease.
so
So, in March, I was like, hey, so what's the animal model like? I told him to take any, like,
yeah I think
about 2
it's
years.
late.
So we were kind of, it's a really cool.
I'll use a baseball terminology.
Yeah.
Got some compounds when I'm trying to learn.
Yeah. So, we thought for sure, people are gonna, not like,
Yeah.
Thanks for explaining.
but the scientific is very good for because he has a really cool way of approaching it. And it was hard, actually, in the professional board meeting, it said, well, everybody has the 2-year timeline problem with animal models. This guy's actually an expert in animal models. Nobody's doing it. They should be.
That's
So-
a good point, yeah.
So we picked it. And then the thing, the plan is to get to a point, proof of concept as quickly as possible and then get planted.
Yeah.
Yeah.
And there are rare disease groups out there, not just philanthropic, but companies that do rare disease. Some are seen as, some are just non-oncology rare disease.
Mhm.
So there are groups out there that are looking for this.
Yeah. All right.
Yeah, just, want to find some good nutrition programs because there's more coming through.
Mhm.
You know, we've got our own some internal ones, PD1 program, nice. Those kinase one, I think, you know, again, gotta get some data.
Yeah,
Get out
I
of the
think,
screen.
yeah, we're meeting in Innovate, I think.
So like AstraZeneca and Bayer, those like, you know, when you guys get some material in, you know,
Okay.
come back to us. Company in San Diego, Moroccan Therapeutics, genetics.
Okay.
EQI30 checks, if you look at it, it's not a little over reports. But,
Yeah.
basically,
That's cool.
I said, well, we'll be fine. I don't know if Mark would be.
Yeah.
Be good.
Mhm.
You know, so,
That's exciting.
you know, it's just getting to the right, getting to the sort of the leverage point where companies can say, okay, now
Yeah, for real. The content packages. Yeah. Is CJ on the phone? Maybe they have a celebratory.
The red line they came back, I didn't see anything, I would read through it again, nothing that made me sort of come ahead of this.
Okay.
Mark, it's down here at Phones Edition.
You're long enough, I still worry, I planned ahead, I got here early, so we didn't have a clock yet.
Right. Well, this is good enough for us. All right, full house. Thanks everybody for coming on this beautiful day. So today we have a special treat for us because we have Mark Rivera. Yeah, pizza too, but because he's actually not in Birmingham, so he flew in specifically for this seminar. Well, somewhat, sure, let's call it that. But he is actually the Director of Business Development at Southern Research and actually represents the ADDA projects when it goes out to meetings like Bio and Bio Europe, we're just talking about, where he plays matchmaker between the science that we do here at UAB and Southern Research and the projects that we have and companies that may be interested in our technologies. And as I was alluding to last week, I think, when I was talking about the seminar coming up, it's like a little bit like dating. And he has coffee with lots of potential prospects. And he doesn't take that many home to go meet mom.
No. Well, actually, an analogy to that in my presentation.
Okay. So I'm excited to kind of talk about this aspect because it's something that I think in an academic setting we're not that exposed to. So Mark has been really instrumental in helping with that. He has a lot of experience in this. PC in genetics, I think, MBA. Yep. And just has worked himself out of a job before because he pretty much sold everything to,
not exactly.
Well, we'll call it that way.
Oh.
So for the people looking out online, so Mark, I'll ask you to be clear by the microphone.
Well, also I know there's overhead microphones as well.
Oh, okay.
So I was told. I you're live.
The technology is amazing.
I tend to pace that.
Okay. So if you have questions at the end, I will check in the chat box. And then, of course, you know, take care of that. All right. So
thank you much, Mike. Thank you all very much for coming. Being indoors on a day like this, coming from, I'm working out of my home office in New Jersey, so the weather here is definitely upside this week. So what I want to focus on, as Mike said, was really just talking about some of the considerations that companies have regarding programs and projects. And it's difficult. I know I used to work in the lab. I refer to myself as a lab scientist. I used to do science. Before I realized I could probably do better this way. But to try and bridge that gap, because when you're in the lab, when you're in the clinic, you're kind of really focused on what you're doing, and it's a little hard to kind of get the longer view of what's happening. And when people who do research are thinking about business development, it's a term that's out there, it floats around, but for many people it's kind of a black box. You might have had some success with programs or read things in the newsletters about companies, and it really comes down to like a three-step process. First is there's some really cool, innovative research results, either from the lab, again from the clinic, and then some stuff happens in the middle, black box, and then poof, you get a ton of money from a pharma company or a VC person because they love your cool stuff. And basically, that is how it happens. And but since I don't want to just say, okay, thank you and have a nice day, I'd like to kind of take a little bit of time and go into a little bit of what happens in that black box to kind of explain why I don't sleep the way I should. So maybe we develop a working definition of business development, which is a little different depending on which part of the pharmaceutical and biotech industry you're looking at. If you're looking at where we are in the overall arc of things very early. Some cases very, very early. So business development to us means one thing. It's different if you're looking at the generics side of the business. But we're going to focus on where we as Southern UAB ADDA, where our programs are at. And because we are early and we know our limitations and also our strengths, we know that we can come up with novel, interesting science and really cool, interesting compounds and good data. But we can only take that so far. We can go to IND potentially, or because I know UAB has a phase 1 unit, in theory we can do some phase 1 work. But beyond that, we need help. So really, I think for our purposes, as an academic organization, for us, business development is really finding a partner who can take a program forward on our behalf through clinical development. And sometimes it gets extremely complex and hugely expensive, and ultimately to the market. That's really how we're thinking about business development. So if we look inside the black box, in theory, on paper, the process that we go through is pretty straightforward. And just kind of going here from left to right, we start off prospecting, looking for companies that might be interested in the program. And then you have confidential scientific discussions where you really get into the details. Negotiate potential deal. You let them come in and look at everything you got. Due diligence efforts, because it's their money. And close the deal and everyone's happy. In theory, this is a very linear process. It's a very sort of algorithm type thing. In practice, it looks a little more like this, where you're taking 2 steps forward, 1 step back, 3 to the left, and it's whether to laugh or cry is depending on the day. But it can be frustrating with companies, and I'll give you a couple of examples of how that works. But are you guys familiar with the story, the fairy tale of the princess who goes around kissing frogs? The idea being that if she finds the right frog, he'll turn into Prince Charming, marry her, and live happily ever after. That's kind of business development. That's kind of what we do. We kiss a lot of frogs. And I apologize if any of you are in a long-term relationship with an amphibian. I don't mean that's but it's just, it is a reasonable analogy for what we do. So if you have to go around kissing frogs, planning is important because you want to reduce that frog-prince ratio, right? At least as much as you can. So to do that, you have to understand the industry, understand where you are. So for the program that you're looking at, any particular program, what is the indication? Is it not just oncology? Maybe it's solid tumors versus liquid tumors. Maybe it's first line versus third line. Maybe it's combination monotherapy. What's the indication that you're trying to get across to a potential partner, get their attention? What's the competition out there? Are you really cutting edge, or are there 5 people that are ahead of you and 3 programs behind you? That changes the dynamic tremendously. And knowing about our own program, good and bad. Because as much as we love our little firstborn children, they have some issues along the way, right? So,
Hey, I'm a first gal.
so the point is, we don't know. Certainly we want to talk about the good parts of our program, but we don't know where the gaps are, the bad parts. The companies we're talking to will find them and tell us, and we need to be sort of ready to discuss that. So, again, part of the process, if you look at the world of pharma and biotech, it's quite vast. So who's in a given therapeutic area? CNS programs. Some companies do CNS, but they don't do neurodegeneration. Some do neurodegeneration, they don't do Alzheimer's. You got to work through the process and filter. I spent a lot of time online going through company websites trying to figure this out. Who has a competing program? So if a company is, let's take the Alzheimer's example, if someone is working in Alzheimer's, but they have a program that is very similar in mechanism to ours, I might not want to talk to them right away because don't want to reveal too much about what we're doing and make their life easier with their own internal program. Some of the companies are open to early stage assets, very early stage assets. Some are not. Some say, you know what, I really can't talk you to get human proof of concept, so phase 2. It goes to the side and go, so there's a funneling effect, a filtering, as it were. And then ultimately the question is, when you approach them, is there any interest in our program specifically based on what we have today? So even with applying all these filters I've talked about and all the screening and looking and evaluating, we still talk with a lot of different companies and a lot of different types of companies. Some of the usual suspects, big pharma, the Mercks, Lilly's, Novartis's of the world, and we'll include big biotech as well, the Amgen, Genentech, Biogen, those guys. There are a lot of regional pharma companies out there as well that are only work or have commercialization in, say, Europe or Korea or Japan. But they're could be interested in early stage programs, so they would be someone to talk to as well. Specialty pharma, companies that only do oncology or only do CNS or only do fill in the blank. Classic biotech companies that we hear about all the time. Another group that I call, for lack of a better term, in-betweeners. Now these are pharma companies that look for early stage programs, so we like them in that regard. They like to in-license from universities or places like Southern, the ADDA. Advance those programs into phase 1 or possibly phase 2, and then out-license to the big guys after that. They kind of bridge that gap of the initial clinical proof of concept, do all the IND work, etc. And in theory, we would share the benefit with them when they successfully out-license to Pfizer. And also, increasingly in the last year, I've been talking to investors not as with the purpose of necessarily talking about spin-outs, but is there a way that our programs could fit into their portfolio? They could build a company around our assets, or they could add our asset to an existing company. So the different ways of making things work. Trying to leave no stone unturned, basically. So many different companies, many different business models, but all the discussions with these guys start the same way. Set up a meeting, you walk into the room, you sit down, they look at you and they say, tell me about your program. What makes this so fun? And there you go. Now, to be fair, though, they look at us as frogs as well. They're trying to find good programs to bring into their company and their pipeline. So they're looking at a bunch of dancing frogs on the other side of the table. So it's not just them. So you talk about your program, and we get a lot of the very similar questions. There's really a set of standard questions that come out from the process. How far along are you? Are you far enough along that our guys who are interested would be engaged? What's your IP status? This is a huge thing. Have you filed IP? Has it been issued yet? What's the IP landscape? Do you have other people out there? Some programs, LARC2 is one that has had some questions about, can you differentiate your IP from everybody else's? Because you're inhibiting a kinase for a specific protein. So it gets a little tricky. So these are all questions that will come up. In vivo proof of concepts. Big value inflection. You have a new mechanism. You've shown that it works enzymatically. You've shown it works in cell-based assays. Great. You have good PK, but can you then take those compounds, put them into an animal model of disease, and get the expected result? Which is a lot of steps from running a high-throughput screen, as we're learning in many of our programs. But that is, in vivo POC is, for many companies, a really big deal, really big step up. And then, how long before you get to IND? I got that question from a company 2 weeks ago on one of the programs.
And then you started laughing?
No, I said, no. My standard answer is, I'll check and get back to you.
Oh, there you go.
One thing I've learned over the years is don't over-volunteer information. Sometimes it's very scientific detail. It's beyond my knowledge, or if it's something like that, I need to make sure I don't want to overpromise. And then you get questions that are very specific to the program. So I'm sorry.
So with what you said about Mark II,
Yeah.
I work on that. So how would you distinguish, your inhibitor versus another? Would it have to be like structure or where it's inhibiting, or does that matter in the end for IP? Like, is it the effect of the inhibitor, or is it specifically what it's doing to inhibit?
I think they're all pretty much inhibiting the same way, if I'm not mistaken. Structure is the very last thing you share with a company, first of all, because we like these people, but we're still a little paranoid. A little paranoid goes a long way. Differentiation could be in IC50 values. It could be on the PK side. It could be bioavailability. It could be half-life, toxicity, side effects. There's a number of ways that you can differentiate scientifically and show that yours is hopefully better. On the IP side, that's more of a question for the patent attorney, because those people can do some fairly creative things about trying to differentiate 5 molecules that are all coming in the same active site of the same enzyme. But for something like ARC2, that is an issue when you have other programs that are out there and known to people who are in this field. And to that bottom bullet here, when you talk to people, the big pharma people divide up their business development because they are looking so broadly and have so many people. They have, I didn't put a slide, I should have put a slide, but they have, business development for us is pretty much me, with a lot of help from Mike and everybody else. But you look at, for example, Merck, they have a business development group, and then they have, these are the search and evaluate people that go out and talk to people like me. And then they have the transactions people that actually do the deal all the way through. And then the search and evaluate people, you can cut them further now, and you have North America, Europe, Asia Pacific, and then you cut it preclinical, clinical, marketed, and then you cut it by CNS, oncology, infectious disease. So it's like five-dimensional array. So you got kind of, but once you get to the right person within the search and evaluate group for preclinical neurodegeneration programs, and they really know their stuff. Yeah. So they know a lot more about it than I do. I know a little bit about all the programs. These guys are really focused. And have you seen a paper by so-and-so that was published last year on? No, but I'll check with my guys and get back to you. I've done that more than one occasion. So the people you're dealing with on the other side, I joked about drugs, but they're extremely intelligent and very, very deep in their knowledge. What it all comes down to, in terms of moving forward with any company, is the data. If we don't have good science, we don't have solid data, there's no reason for me to be doing what I'm doing. So it all, I always come back to the scientists, help me out. You guys have to help me out. I need some data. What do you think about this? Again, dealing with some really good people on the other side of the table, and they understand this, and they really need to know what's going on. So in basic science, to be able to, if you can show that you have a novel insight into a disease, novel mechanism, novel target, a new way of thinking about it, that certainly gets a lot of attention. Clear understanding of mechanism. This is another issue that we've been talking about. Phenotypic screens are a great way to start, and they get some really cool results. But ultimately, it's very, very difficult to get a company to do a deal if you cannot map out the mechanism on the whiteboard. They're not going to license the black box. And again, in vivo proof of concept, that's always nice to have. It certainly makes life a lot easier for everybody. On the more applied science side, how good is your chemistry? How many scaffolds do you have? Any warning signs in the molecules, reactive groups? I'm not a chemist, I apologize. Get the questions. What kind of PK do you have? Any toxicity issues? And of course, intellectual property based on the compounds that you have. So these are all, all of these have to be solid data sets and all the boxes checked for people to move forward. All right, so meet these guys, talk to the drug. Meeting went well. Who's next? So, remember that nice linear algorithm I showed you earlier? After all that, that's how far we got. So you see, there's still a ways to go yet to get all the way down to the far right-hand side. More science. We need more science. There's no such thing as too much data. Really, there's no such thing as too much data. That's bad data. But it's good data. You never have enough. So it's really important, especially for our programs. We are very early. most of our programs are novel mechanisms that other people have not thought of or not heard of, so you have to educate them. So to get buy-in from their scientists is really key. Because if their scientists don't understand what's going on, if their scientists have questions or concerns about this mechanism that we're trying to explain, we're going nowhere. Because the scientists can't sit internally in their meetings with their business people and go, we need this. It doesn't happen.
So question, what if their science is not as good as we are?
We never say that.
No, we cannot say that. How can we complete?
Well, what we do here, so the third point here, right? As soon as possible, I try and get a call set up with their scientists and our scientists. Even if it's non-confidential, we're not talking about this, we're talking about the science, the mechanism, the underlying biology. Because if it's a new biology, new to them, a lot of times it's very helpful to get on the phone for an hour, I don't care, 2 hours, whatever, and just have a very much a peer-to-peer discussion about the biology, about the science. They go back and forth about this publication, that publication, this control, and hopefully in the end, their guys walk away and go, I get it. Doesn't mean that the ADDA has a compound or a program, but I, as the big pharma science guy, I get the biology. So if you can do this, I'll believe that this is something great. This is a new approach to my disease. So that's, you hope they're that good, but the idea is to just, in some ways, in many ways, educate them. So let's say we get the scientific buy-in after all that effort and time back and forth and Q&A. Now we move on to the next step called a term sheet, coming to terms, which is really a summary of what each side would do if a deal happens. Kind of laying it all out. So roles and responsibilities. So this is some examples here, not by no means inclusive, but who pays what to whom when. What's the territory for commercialization? I mean, does the other company want worldwide rights potentially, or do they only want Korea, Japan, and Botswana? How are decisions made in the research process as you go forward toward IND and clinic? Who takes responsibility for the various things that have to happen? Patent filings and prosecutions, regulatory filings, all of these things, manufacturing, scale-up. And what happens if they change their mind? So if we partner with Pfizer on a program, they could reorganize again, and suddenly our program is no longer interesting to them. Not for reasons of anything related to science at all. It's just, oh, we're not in this area anymore. So we have to figure out what happens. We need to get everything back, but we need to make sure, lay that out very clearly at this stage. And conflicts, which are always a risk. How do you resolve conflicts between the two parties? So there's a lot of things that go into this. It's called a term sheet, but in fact it's multiple sheets when you're all done with it. The idea is to just kind of lay out bullet points and go back and forth and try and work it out. And in this process, the under thing is you try and build a relationship with your counterparts so that you can have sort of heartfelt conversations of the sides. There are times when I've had talked to people and I said, go take a coffee break over here. And I said, on this A, I can move a little bit toward where you need to be, but if I change anything on B, I'm going to get fired. You can't move on that. And with the relationship in place, they'll believe you and not think you're using that as a bargaining gimmick. And they will tell you the same thing as well. So you have to kind of trust each other that you're really trying to work toward a mutually beneficial goal here. And then after that is that diligence effort I mentioned. This is where pretty much everything is on the table. Because if they're going to come in and pay money, they want to make sure that everything we've said, all the data, all the results are, in fact, exactly what we've said. So I've seen diligence efforts where a company will come in and go through notebook by notebook and literally animal by animal on an in vivo POC. Clinical programs, they will go patient by patient. They will look at all lab values, enrollment, pre-dose, post-dose, check every single everything. Manufacturing, which is not really one of our issues, but the same thing. They'll do the same kind of diligence effort to make sure there's nothing that's been either misrepresented or overlooked. And a major part of the diligence for us also is intellectual property. So what are the applications that have been filed? What have you gotten any feedback from the patent office? Have any patents been issued? And do you have a freedom to operate opinion? Now, freedom to operate, FTO, is a legal phrase where you as an inventor go to a big and expensive law firm, and with your patent application, I should say, and they do a very exhaustive survey of all the other patents related. So this would relate to something like LARC 2, where you have other patents in the area. Is your patent distinct enough from everybody else's patents that you're not going to get slammed with infringement? And while the result from the law firm is not a guarantee, it's a legal document that they sign and they give their opinion on. And if you have a freedom to operate opinion, that gives your potential partner a lot of breathing room. Less so for programs where we're the first mover here, but for where we're in a situation where you're competing with other people, the FTO is very important. And very expensive, by the way. I mentioned that big law firm equals big money. And finally, not quite finally, almost finally, we get to what's called the definitive agreement, which is basically the term sheet, but all wrapped up in legal language, because that's what lawyers do. It also includes a lot of other things, that guarantees and warranties, like yes, we have the right to sign for this, yes, we really own it, no one else has rights to this, and yes, we can do this without, all the stuff. It's lots of billable hours for the lawyers, basically, and it ends up being a 30, 40, 50, 60-page document, depending on what font size you use. But it is a legal contract signed by both sides, binding, and that is the deal that finally wraps up. Lays everything out in painful detail. And then finally, the closing of the deal, where you get final signatures on the agreement from those who are authorized to sign. My hint here about avoid holidays, if you're trying to get it done quickly, avoid holidays. My case, it was with a French company in the summertime who shut down in August. And I had a CEO who had no concept of that. He couldn't understand why they didn't answer the phone, they didn't answer email, it's like, it's August, they're French, we're done. They said they're back on September 3rd, and sure enough, on the 3rd, boom, they were back. But it was a very rough month for me. Also, another component that sometimes pops up is something called, on the U.S. side, something called Hart-Scott-Rodino, which is a legal review to make sure that the company that is bringing your asset in is not going to have a major monopoly within that field. This applies across all industries, not just pharma. For what we do, where we are sort of in the novel new drug area, it really doesn't apply, but many times it is a box to be checked, and you really cannot finalize until the government says you can finalize. So it's a process. Another 30-day delay after you've been fighting this for forever. And then after that's done, cashing a check is a great thing. Hitting the bar is a better thing. Hopefully we can be partners. You go out and have a wonderful time and just relax and kick back and go, yeah, I could have killed you 3 months ago, but now we're friends. So that's really the splashy headline part of it. But after you hit the bar that night, you realize you have the next morning. As you stagger in, and you realize, okay, so now we just got married to this other company. How do we manage the relationship? And that comes under the heading of alliance management. How do we keep track of things? How do we, remember all things we agreed to before the term sheet, like who pays for what and when, and who does what, and when it's supposed to be done, and we got to track all that. Because in this deal, there are milestones that are coming to us, money, payment, milestone, and we have to hit them, they have to hit them, so it's in our interest to track everything. So agendas, budgets, meetings, quarterly reviews, how do you report to your senior management? How do they report to theirs? Full-time job plus for alliance management. In the big pharma, there are departments of alliance management, separate from business development. And again, as I mentioned before, hitting the milestones that are built into the agreement. So if you hit an IND filing, that could be great because suddenly it's money coming to us. So what do we have to do on our side to make that move along? And how can we support our partners so they can move it along? And how do we, I didn't write this in there, keep track of what they're doing to make sure they're moving it along? So there's a lot of, after the deal is done, there's a lot of follow-up to make sure that the relationship is successful. Because, as you guys know, data is data, and sometimes it just doesn't work out. And so a lot of deals never come all the way through because you never get out of phase one. But that you can't control. You can just do your best. So all the stuff behind it, the relationships, the reporting, the working together to try and make that, to increase your odds and to be successful. So going back to that, again, that sort of algorithmic blue line that I had before. In theory, a deal can be done you probably do the whole thing in 6 months, start to finish, in theory. Talk to 1 or 2 companies, you've gone through that filter, these are the guys that really are a good match with us, and you work through it. I would love to have that happen once. It hasn't yet. In practice, it's probably more like 18 to 24 months from the time you first meet a company to the time you would ultimately sign a deal. And discussions with a lot of companies. I think 40 is about as many as done for one program. You don't realize until you start digging how many companies are actually out there. Now, companies say yes for a number of different reasons. Sometimes they have a gap in their pipeline. They need something to plug in to make sure they have continuity. Programs come in as other ones move out. They may be invested in a therapeutic area. They may be invested in neurodegeneration, for example, and they want to plug in a Parkinson's program to build out that pipeline and fortify it. They may want to broaden the pipeline. They may be, for example, they may be in pain that want to broaden but stay within CNS. So, okay, maybe tau fin looks interesting because it's CNS, but it's not pain. But we know CNS would want to be in that area. Obviously, a program has to clearly show value, not only scientifically, which is where our main concern is, but also commercial. Can they make money on it? In their analysis, can they actually make money on it on the other side, given all the development costs and risks and expenses? And sometimes they don't admit this, but sometimes they're just keeping up with the pack. So look at immuno-oncology, for example. Everyone's running one side of the boat because that's what everyone's doing. So there's a certain amount of that groupthink also in this one. Now, there are also a lot of reasons why a company would say no. In our case, most often the program is just too early. In that case, they might not say no, they might just say, not yet. Come back to me in 6 months, or come back to me when you have X. Sometimes they look at multiple programs for a certain indication. They need an Alzheimer's program. They don't pick ours, they pick somebody else's because they like the mechanism or it's further along or any number of reasons. Sometimes they're not really looking to license anything at all. They're just trying to see what's out there, which I think is very sneaky and unappreciated, but that happens. Or there are questions. Back to the science, getting the scientific buy-in. There are questions about target. I don't understand the mechanism. How specific is this? Chemistry is a little sketchy, or PK, we don't see how we can improve it. There's a tox issue. Many things that happen. Data, we can't control. We can just kind of go with the flow.
So you said the program is too early. At what stage you think your program is too early?
Depends on the company and the program. I'm not being dismissive at all, but it really is very case by case. I mentioned in vivo proof of concept. That is a big deal, but sometimes it's not enough. Sometimes they want you to go all the way to have something that's ready for IND filing. They want to have the GLP tox in hand, or maybe it's just getting ready for GLP tox. It really is very much based on the company, based on what their thinking is, where their comfort level is with that indication.
So, does any company interested in licensing a drug target?
It's difficult. I think that's very difficult to license a target because there's all the questions of, can you drug it? Is it a druggable target? Is it a specific mechanism? There's a lot of what they sometimes will license as a technology platform. You see some big deals where biotechs that have a way to generate novel monoclonals, for example, against an array of targets. So they'll do a deal with that with a small biotech, okay, and it's a large amount of money, but it's per target, at 5 targets that the big company picks. But for a specific target, it's pretty unusual unless everyone is unless it's hitting the evening news as a target, but that doesn't really happen. Really better to have chemical matter in hand, show that the mechanism works, and here's how it works. So we're talking about why companies say yes, why they say no. The point I want to make is that things do change, and there's an interchangeability between yes and no, or in this case, between frog and prince. And these are all examples of things that I've heard over the years. These are all nothing to me. And some of these can be good news, and some can be bad news. And we can talk about the top one there, that there's been a change in strategy. So if a company has said, no, thank you, it doesn't really fit where we are right now. And then you can get a call a month or 2 later from the guy and says, remember that program? Didn't change the strategy. And I thought I'd give you a call and let you know. That's a good thing. Or if a company has said, yes, we're interested and we're looking at it, and you get a call from a guy and he goes, there's been a change of strategy. I thought I would just sort of let you know. Not a good thing. So all of these could be kind of, things like the team is being relocated is always almost never good because that means they're shutting down for 3 months. We're going through a reorganization, not good. New CEO, maybe good, maybe bad. So these can go a couple of different ways. We're being bought also is one that usually does not work well for us. So because then we don't know what we're doing. I'm going to have a job next week. Good luck, bye. So things change. And so until the deal is signed and the check is cashed, the deal is not done. But the other thing I try and do, and I think it's important, is just try and generate kind of a virtuous cycle. Because when we have a program coming out of the ADDA and put together a non-confidential presentation, go out and talk to companies and say, I know this is early, what do you guys think? And we'll get feedback. I try and gather, like, we like it, we don't like the target, oh, that was tried 5 years ago, or I don't understand it, how specific is it? I try and bring that back and then get that information back to the PIs. And maybe there's some value there for the PIs to maybe think about the program, maybe tweak things a little bit, or maybe reorganize the sort of experimental priority a little bit, maybe, and refine the program, and then we'll go back out again and see. So hopefully there's some nice positive feedback, which ultimately benefits everybody. That's it. Thank you very much.
Thank you. I had a question to talk myself. Could you speak to, and it's been a concern for some of our PIs, what if you make a deal with somebody and they just put it on a shelf and don't do anything with it because they're afraid you're going to be competitive with it?
Right.
What can we do to
that is one of the terms we talked about. So that list, the term sheet thing we talked about, one of the things that we always put into a term sheet and the definitive agreement is something called diligence, which is different than the diligence I talked about in the slide. But diligence in that, okay, you guys are taking this program into your labs, into your shop. Now you are guaranteeing to us by signing this document that you're going to put forward the same level of effort and investment with our program as you would put in with one of your own homegrown programs at the same stage of development. And because of, through alliance management, we can kind of keep an eye on how that's going. If they don't, then we can say, excuse me, we get that back.
Can I ask what your sense is of all the talk about marching rights, buy Dole?
I'm sorry about?
Marching in rights and buy Dole pullbacks and federally funded programs.
I'm not that familiar with that. I mean, this is about the government coming in and.
Right.
Yeah, I don't know if they've ever done that in this country.
I've just seen it last couple of weeks.
Yeah, I don't. Yeah. I'm not that familiar with it, so I don't think that's not something that I've heard people people being concerned with. In other countries, there have been issues with new drugs that are being sold at for that country, high price. And the government will then come in and say, that's too expensive. We're going to give a license to this generics company to make the same thing at 1/20th the price and pay you a 2% royalty. You have nothing to say about it. Thank you. Get out of here. That happened in India and a few other countries. But in the U.S., not a concern too much.
Other questions? Let me check the online chat box real quick.
No, sorry.
before
We
we
do that
are.
anyway.
That's okay.
I don't do tech stuff.
Chat. It is empty, so we'll call that very clear presentation.
Very good.
Thanks all for coming.
Silence implies consent, or let you know that no one's even listening.
Yeah. We have 3 attendees, so
All right,
yeah. So next week we have talk about pharmacokinetics, and person who's presenting at ADDA is probably the best explainer of PK. So if you've always been like, oh, pharmacokinetics is over my head, come next week and then we'll explain it and you'll understand.
I should say that.
You can stay for another
I should stay
week.
for another week.
Yes. All right. Well, thank you so much. See you next week. Like we're checking.